Do you find it difficult to examine or do procedures in small children? Do they cry or thrash about a lot? You may find that by following some of the following comfort holding techniques, you can make things much easier for you, the parents, and the child. Firstly, make sure you are prepared and have all the equipment you need before doing the procedure. There's nothing worse than having to leave the room for something midway through a difficult cannula. If you're doing a simple procedure or an examination, keep the child where they are comfortable if at all possible. Examining a child in their parents' arms or when taking a feed will be much easier than lying them down on a cold examination couch. Explain the procedure simply to the parents and to the child if they're old enough to understand. Be honest and explain to them that it will hurt for a short period, but they will not keep trying too many times if it doesn't work. Always use analgesia, such as sucrose, cryogesic spray, or local anesthetic cream for painful procedures. Explain clearly to the parent how you want them to hold the child and encourage them to stay calm and keep their breathing regular and slow. Children can sense parental anxiety, which increases their fear. Always have an assistant with you as well as the parent, such as a nurse, HCA, or play therapist. If required, the following comfort holding techniques can be really helpful for examination and procedures. In the side sit procedure, the child sits sideways on the parent's lap. The parent wraps both hands around the child in a comforting hug. This is very useful for vaccinations, blood taking, or blood pressure procedures. In the back to tummy sit, the child sits facing away from the parent. The parent wraps their arms around the child's arms and their legs around the child's legs. This is useful for examining the chest, and by putting one arm over the child's forehead, this can be used to examine the ears and throat as well. In the tummy to tummy sit, the child sits facing the parent with their legs and arms wrapped around them. The parent puts their arms over the child's arms and keeps them strongly held. This is my favourite way to do blood tests from a child's hands, and it also works well in older children. If you need to use an examination table, get the child to sit on the table and have the parents hug the child from behind, putting their arms over the child's arms and legs. This can be useful for procedures involving the legs. The MEG Foundation has a number of very useful resources for healthcare professionals and parents, and the animations used in this video came from their resources. I will soon be releasing a detailed video on venipuncture and IV cannulation for paediatric newbies. Make sure you are following and subscribe to the Peds Life Instagram and YouTube channels. See you soon.